Hi, I'm Dr. Sandy Werner, and this is the Access EM video on differentiating an abscess from cellulitis using ultrasound. This is Dr. Dan Haggerty, who will be performing the procedure today. Our patient came in, he's a bilateral lower extremity amputee, and he has one swollen stump. So our goal is to discover whether there's an abscess or cellulitis in that area. We'll be using a linear high-frequency transducer. And we'll first apply gel to the area. And he'll place the transducer on the patient's leg with the indicator towards the patient's right. So you can see the little strip there, that's the indicator. To make sure he's in the proper orientation, he's going to depress the skin by the indicator. And you can see on the ultrasound screen the corresponding image of the skin being depressed on the ultrasound monitor. He's now going to scan down the leg from the normal tissue through the affected area. And he's using pretty minimal pressure because he doesn't want to cause the patient any additional pain. And as we're scanning through, you can see that there's what we call cobblestoning. It looks like white stones in amongst a darker area, and that's consistent with cellulitis. Once he's scanned all the way down in the transverse plane, he'll turn the transducer with the indicator up towards the head in the sagittal plane. And now he's going to scan from left to right all the way through the affected area. Once again, we're looking for any discrete pockets of fluid that we might be able to IND. And as he's scanning through again, you see the areas of cobblestoning. If he compresses, you'll actually see that the cobblestoning compresses, indicating that it's not a solid collection of fluid. In this patient, we found an area of erythema and cellulitis that actually has an underlying abscess. So now we're going to show you how to mark the abscess for incision and drainage. So Dan's putting some gel over the affected area, and now he'll scan once again in the transverse plane with the indicator over towards the patient's right side. He's going to scan all the way down through the cellulitic area and back until he identifies the deepest pocket of the abscess. And once he does, he'll mark it on either end of the transducer. This makes a line on either side. Then he'll scan in the sagittal plane. He's going to turn the indicator up towards the patient's head and scan from side to side through the abscess until he identifies the deepest pocket. And once again, he'll mark it at either end of the transducer. Then he's going to wipe off the gel, connect the dots. Smears a little bit, but we can still see our lines. Connects the dots through, and X marks the spot for our incision and drainage. Once the procedure is done, we need to make sure we wipe the gel off the transducer, spray it down with tea spray, and wipe it off to make sure it's ready for the next user. So once again, we've seen how useful ultrasound can be in helping us see what's underneath the skin. In this case, differentiating cellulitis from abscess, so we can potentially avoid doing unnecessary incision and drainages on patients. Things to remember are just to keep the transducer in the proper orientation with the indicator towards the right or towards the patient's head. If you do that, you'll have no problem with this technique.